Good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. Thanks for being with us today. We have with us Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. And we also have Elizabeth Holshoe, who is the Director of Epidemiology. I'd also like to thank Allison, our ASL interpreter, for being here today. Thanks so much. Dr. Ariola, I thought maybe you could start with telling us how today's vaccination clinic went.
Thank you, Jody. Good afternoon, everyone. We had a clinic today, which was largely focused on providing second doses to residents, mostly 80 or older. And our staff ran another excellent clinic today. Everything went pretty well. We gave out around 1,400 vaccines as planned. And then we again have one more tomorrow. Tomorrow, Wednesday, you'll remember that we had to cancel a clinic last week, Tuesday. And so everyone that was scheduled for that day has an appointment for tomorrow at the same location at the same time. The weather has been pretty friendly this week. It's not quite, will not be quite as good tomorrow, but still a lot better than it was last week. So we expect the clinic to run pretty well. And so if you have an appointment, show up. Our staff will be there ready to vaccinate. And the rest of the week, Thursday, Friday, we are also still going to focus on those that are 80 or older, except that Thursday, Friday, and Tuesday next week, we're going to be giving out first doses. And we've reached out to every one of our list, on our list that's 80 plus, and giving them the opportunity to book an appointment. We have sent emails, we have made some calls, and we've assisted as many as we can to book an appointment. Now, if you are one of those that do need an assistance in terms of transportation, that's a different program. We're working on those details. Or if you're one of those that we have to bring vaccination to you, that's also a different program. Otherwise, everyone on our list up until Monday had received, and actually even those that we received yesterday or through elected officials, we have reached out to them and assisted them in booking a spot. So after next Tuesday, our clinics will begin to open strictly for 65 plus. And so Tuesday will be the last clinic that's entirely focused on 80 plus group. We're going to continue to vaccinate in that group. And there's a lot of, apart from the clinic that I'm talking about, there's a lot of really exciting news that's going on also in our schools with our educators. Elizabeth shared with me today that we've vaccinated about 51% of those in our public school, and also let her provide an update about that.
Absolutely. Thank you, Dr. Ariola. We are very excited to be continuing to move through our K through 12 educators vaccination clinics. And this is really, we're able to move through it at a much faster pace because of Governor Kelly allocating some additional doses that are separate from what else has been coming into the county. So if you recall, up until this previous week, we would get a number of doses into our county health department, and then we would allocate those out either through our own clinics or to our healthcare partners. And we were setting aside doses strictly for our K through 12 educators. But now with Governor Kelly's announcement, we are getting additional trays, which have accounted for almost 6,000 doses that will be coming into our community over the next week or so, strictly for K through 12 educators, which means that really within a couple of weeks, we should be done with the majority of educators in Johnson County who work for Johnson County schools, both public and private. And so again, really because the White House and Governor Kelly has prioritized our educators to get them vaccinated, which can really help our schools stay open because you don't have to worry about staff being quarantined if they're exposed or if they are, and they won't be getting sick because they will be vaccinated. So this means that it's more stability for our schools. They won't have the struggles that they had with fill substitute placements, which they really struggled with in the fall. And so really great news for our schools and our education system.
And the 51% approximate number that we throw out there, that's assuming that 100% of the educators wants to be vaccinated. So if you're assuming perhaps 80%, that percentage goes up. Is that correct, Elizabeth?
Absolutely. Yeah. So at this point, we're just looking at the total number of staff who work in our school systems, and obviously not everybody will want them. Of course, we wish they all would take them, but so at this point, we've done 51% of all eligible K through 12 educators. And so as we get closer to the end, as we start sort of figuring out who's left, that will definitely move our timeline a little bit, but hopefully no more than a week. So yeah, very exciting.
And then I know that childcare providers, you talk about childcare providers, often at the same time as educators. So what's an update on vaccinations for childcare providers?
Absolutely. So because we've gotten some additional doses in from the state that have to be used for K through 12, we've had to shuffle around a little bit, but our daycare providers are getting another clinic just for themselves, not a week from today. I think today is Tuesday, so March 2nd, they will have just under 1,200 doses just for childcare providers, and that will bring us up to about that 51% level for them. And really within another about 1,200 doses, we should be pretty close to finishing up all of our daycare providers too. So, really depending on how the vaccine comes in, we could be talking about the middle of March by the time we finish our first doses for both K through 12 and childcare. And then next Saturday, the 6th, we'll be doing our first second dose clinic for our childcare providers as well. So things are moving very quickly for these individuals, but it's just a great benefit to be able to get them vaccinated to protect our kids, to keep them in daycares and schools and not have to have these places shut down because of staff shortages due to COVID.
So if a childcare provider maybe by now has not gotten their first dose, or they don't know exactly how they can get on a list or how they're going to be contacted, can you just give a little bit of information on that?
Absolutely. So we are reaching out to all of our childcare providers through our childcare licensing division. So if you are a licensed childcare provider in Johnson County, please reach out to the childcare division. Eldana Chestnut should be the point of contact. Hopefully you've received a number of emails from her. That's how she communicates. If not, feel free to give them a call, or you can certainly call our hotline if you don't have that number, which is 913-715-2819. And they can get you connected to Eldana and her team. But at this point, we are just going through licensed childcare providers. It's how we're able to focus our vaccine doses and have sort of the biggest bang for our buck at this point. So feel free to reach out if you haven't heard. We sent out additional emails today, as well as last Friday for the clinic on March 2nd to get people signed up.
And there's, thank you, Elizabeth. I do want to spend some time just talking through the logistics for our 65 plus group, which remains our top priority. Again, the last clinic for us with a focus on 80 plus will be March the 2nd. That's next week, Tuesday. So beginning Wednesday and for the rest of the week and for the foreseeable future, because we still have quite a few vaccinations to go in this very large group, our focus will be 65 plus. And there's been a lot of questions that we have received. We have vaccine. There are more channels, more avenues to get the vaccine than just the Department of Health and Environment clinic. There are more pharmacies that are able to vaccinate in that group now. And of course, our health systems are vaccinating in that group. Now, this week, as we mentioned yesterday, there are a few of them that we could not allocate vaccines to this week. We're going to try to remedy that next week. So, their focus, our focus, the focus of the pharmacists in the county will be the same. It will be vaccinating people that are 65 or older. And that's the first thing. Second thing is, if you have completed our survey, we have your information. We'll reach out to you. We're working down our list. And of course, how many people will invite depends on vaccine availability. It depends on how many vaccines that we have. And that's true for our health systems also. And so the question that's asked, and I know that that comes through you here, Jody, and that's come through other avenue, is getting on our list really does not mean that you are on the list for the hospitals. The original intent working with the hospitals is they have relationships with several of our residents who are 65 plus over the years. And so what we ask them to do is to reach out to those people in their systems that they already have relationship with. Now, several of them are creating avenues that if you are not on their list, you can signify interest. And so you should also do that. However, getting on our list does not place you on the list for Advent or Letha or St. Luke's or any of the system. We want to make that clear. Now, on our list, we know because they have been vaccinating in this group for the past 3 weeks or so, that you could be on our list and you could already be vaccinated by KU, and that's okay. We are all working from the same pool. These are not the same vaccines that are coming to the county is what we are all getting bits for little parts of. So that's completely okay. But I do want to stress that being on our list does not place you on the list for Advent or Elitha or KU Med or St. Luke's or Menorah or any of them. So if you have an opportunity to get on their list, that's okay too. If you're already a patient of theirs, I think you're already in their pool on their list and they're reaching out based on the number of vaccines that they got. I will say that this week, some did not get anything, others got really very little. So hopefully that gets better next week.
So if you're already a patient of a healthcare system, you might not need to take any action at all. Or you can fill out whatever forms they have available as well as filling out our forms. And there's nothing wrong with being on multiple lists.
That's absolutely accurate. Nothing wrong with being on multiple lists. If you're already their patient, you're already on their list, and they'll reach out to you based on the number of vaccines that they have. There's no question that we are all working towards the same thing. When I say we, I don't just mean the Department of Health and Environment and our health systems. I mean also you. You want the vaccine. We want you to have the vaccine. You want it now. We want to give it to you now. The only limitations that we have largely is vaccine availability, and they need to schedule through that. So we are all working towards the same goal. We want that vaccine in your arm as soon as we possibly can. And we're doing our best. If we have vaccine in sufficient quantity, we wouldn't be worrying about prioritization. We'll just be opening up clinics and having people come and get it. Unfortunately, we don't, and that's put us in the difficult position of prioritizing. And so, but I want to emphasize that we are working towards the same goal. We want the vaccine in the arms of 100% of our residents, if that's possible. And you want it, so we're on the same page. That's why we continue to ask for you to be patient. There's no way you prioritize in that is perfect. So it's not perfect. It's really just a way of walking through what is a very difficult situation of very tough decisions where you really want to vaccinate everyone, but then you're having to prioritize because it's not available. So it doesn't make your need for the vaccine less important. It's just a way for us to walk through the different stages.
And we actually had a question on Facebook that sort of fits in exactly to what you're talking about, maybe someone that's just looking for more specifics. So when you say you're going down a list to get people to vaccinations, I guess someone, what do you mean by that? Whether it's 80 plus or pretty soon when it's going to be 65 plus, is it by age or is it by order that somebody took the survey, or how are you attacking that list?
So I will say both. So we chose to focus on the 80 plus. And again, by now, and I'll let Elizabeth jump in also. By now, we have reached out to virtually everyone on our list and given them the opportunity to book an appointment. So we did prioritize by age. whether it's 65 plus or the 80 plus that we chose to focus on. Now, and now when we're moving down, so when you complete the online vaccine interest form, you get on the list. It's part of a long list, a database, if you will, that we have. And so when we have an appointment open, and if it's 1,400 and we decide to send the appointments to 2,000 people because we know people are getting vaccinated everywhere, I'll let Elizabeth jump in. So what she does is, based on when you complete your record, she goes down and pick the first 2,000. Is that pretty close to what you do, Elizabeth? Yeah.
Yes, that's correct.
So that's what it means going down the list. So like for Thursday, Friday, Saturday, I believe we sent it originally to about 1,500 people. It wasn't filled up. And so we extended that to 2,400 people and got the Thursday filled up. And then when we opened up Friday and Tuesday, we sent that to over 5,000 people that remained on the list. And those positions were filled. We had a few remaining, and we made phone calls to people that were being sent to us, and then we filled the rest with. We still have other persons that needs to be vaccinated for second dose, and healthcare workers and others. So that's what we mean. And so when we get to the 65 plus and we open up the appointment, we go to the top based on when people completed the vaccine, and we move down the list.
So you won't start with 79-year-olds and then 78. You'll start with, once you're in that 65 plus group, it'll be the order that you took the survey is the order you'll be contacted.
That is correct, yes.
Right, okay.
Now, keep in mind that a lot of people have been vaccinated by health systems. And so that's the work that Elizabeth and her team really have to do, which is monitoring the uptake and making decisions as to when they need to expand the number of persons that they invite to complete to book appointments. So it takes a little bit of work as we work through those appointments. So constant monitoring is essential there.
And we do have a question about that 65 group, as far as how long will it take? Do you have a kind of an estimate, at least, of how many people are in that group? And you know how long it would take? Is there a way to know that?
Actually, I would I can say a few things. Like we've got, in theory, 95,000 persons in that group. Some of them have been vaccinated through the federal pharmacy partnerships. Some of them we are vaccinating through the independent living program that we have. Some have been vaccinated by our health systems. And some of them we have vaccinated, because the truth is, every time we open up and we say 80 plus, we don't always have full control. So is that a fair way to say that, Elizabeth? But if tough to, based on the latest number, I think you sent out some numbers yesterday. It is possible that we have just under 60,000 people on your list. Do you want to talk about that, Elizabeth?
Yeah, absolutely. So between the ages of 65 and 80, we have just over 70,000 individuals, Johnson County residents. And so looking at that, we have about 51,000 who have filled out our survey. And so again, these individuals may have been vaccinated as part of the long-term care facilities, or other, if they're still working, potentially in a healthcare setting or something like that. So we will be working through these. I was actually currently trying to pull up a current report to see how many have been vaccinated as of today. So we've finally gotten some access to KDHE's reports, and that is incredibly helpful. We are unable to see who has been vaccinated just in that 80 plus population, but we are able to see who has been vaccinated in that 65 and up population. As I say that, the system is probably going to take forever for me to pull up the new report, and I should have done that before. But I'll tell you what, I will get back to you hopefully by the end of this Facebook Live with the number of 65 and up individuals throughout the county who've been immunized And that will help us as we move through. We'll be monitoring this each day. And I think it's great that our healthcare systems have been focusing on this group and have been trying to chip away. And that's what Dr. Ariola and I keep speaking about, is for each one of these groups, as we complete them, as we move through, for every dose we get in an arm, we get closer to getting through that group and into the next. And this group is by far and large our largest group. And so it's going to take all of us sort of having a concerted effort to get through the 65 and up. And just like that, as I continue to talk, it came up. So as of now, we have actually vaccinated or done 26,000 doses in individuals 65 and up, out of that 95,000 total. So we're moving through and we'll keep working on it.
So does that 26,000, does that include anyone who would have gotten a vaccination from a pharmacy or a healthcare system or your department?
Absolutely. So this is very exciting for us. We've been hoping to get this report for a very long time, and we finally were able to get access to it. They fixed the report. And so, yes, this is actually comprehensive for pharmacies who have been giving it through the long-term care facility project, through our healthcare systems, or even our new pharmacies who are doing the retail pharmacy program. So all of them are required by law to feed this information into KDHE's system, which then goes up to the federal level. And now there may be some delays in data entry depending on the system, but it's a great thing that we now have access to this to see how we're doing as a community to get through this very important age group.
And is that live data, or is it, I mean, I know that you just said there could be a delay, but is it supposed to be live? Is it supposed to be updated daily?
It is supposed to be updated within 24 hours of the administration of the dose. A number of our healthcare systems, the way it works is when they put the vaccine into your electronic health record, right? So you can go online and check to see your vaccines. When they do that, most of our healthcare systems automatically feeds up to KDHE's system. So as soon as they get it entered in theirs, it should be reflective in here.
And is that data the public can access, or is that just for health department?
So this is just a very special report that I think they were very kind to give me access to, but we are working now that we just got access to this yesterday. We're working with our fabulous team in our IT group, our AIMS group, who's created our current dashboard, to see what we can do about pulling this data in on a routine basis to update our community about how far we are with vaccinations in Johnson County. We just definitely wanted to wait to get everybody to get a comprehensive picture as much as possible. So it's going to take us a few days to sort of comb through the data, make sure it is accurate, make sure we're capturing everything. But hopefully in the next few weeks, we'll be able to start getting this out on a routine basis for everybody.
Oh, that'll be great. Maybe we can debut it on a Facebook Live once it's ready.
Hey, look at that.
A couple other questions on Facebook. So some people were asking for an update on our pharmacy program. So specifically, and I know it's not ours, but it's the federal program, but CVS and Walgreens, are they getting the vaccine yet? What do we know about pharmacies and the vaccine availability in Kansas and in Johnson County?
I'll start, and Elizabeth, you can jump in. And I know that Jody, you are updating on our website the list of pharmacies with vaccine, and I think they're getting more than they did last week. The White House is committed to sending more vaccines through our pharmacies. I think you will continue to see the numbers increase in terms of the numbers of participating pharmacy, as well as the doses that they're getting. So CVS and Walgreens, I don't know whether they are transitioning into, because in our county, they are largely done with vaccinating in our long-term care facilities. Now, moving forward, we have some challenges that we need to address, just like we do with the healthcare for those that either missed vaccination the first time or changed their minds on new residents. Those are gaps that we need to continue to find ways to fill. But ultimately, all of the pharmacies, CVS, Walgreens, Hy-Vee, Walmart, all of them, we expect them to eventually participate in providing vaccines to our residents. And the vaccines that go to them really have no impact on the ones that we're getting. Those are additional vaccines that are coming into the county. Now, let Elizabeth speak a little bit more about that, but also to know the numbers she provided in terms of the total number of shots that we have given in the county. We've given over 50,000 shots, first and second doses across the county. But again, she was given the number specific to the 65 plus. So keep those things in mind as you do. Do you want to add to any of the pharmacy distributions?
No, just again that they are focusing on the 65 and up. As I definitely would recommend going and checking out our website where we have links to each one of those. If you are in this age group, our website's an excellent location for you to be able to link to the different hospital systems and get on their list if it's open to the public, as well as the different pharmacy sites where you can sign up for a vaccine. My suggestion would be to expand the search area for the pharmacy that you're looking at. Maybe don't look just 5 or 10 miles from your house, but maybe like 25, and maybe bookmark that page and just refresh it periodically to see if there are any open appointments. I know that they go quickly. And so sometimes it's just luck of the draw about when you jump on that website and see if they have any. So again, a number of are getting those vaccines, and we hope that allocation from the federal government will increase as our allocation also as they're separate vaccine streams for our community.
Somebody asked if they need to cancel being on our list, if they've gotten on another list, or I would add to that, they didn't ask this, but if you get a vaccine somewhere else and you've taken our interest survey, that was kind of the question, do they need to cancel or get themselves off of our list?
I think we decided a while back that you can go, Elizabeth can talk about, I think there's a way for you to cancel on the appointment, but what we don't want is you don't need to call us. We will figure that out, but I believe there's a way to cancel on the appointment. Do you want to talk about that, Elizabeth?
Yeah, absolutely. If you have booked an appointment with us and you have that email that says your class has been scheduled and you need to book or reschedule that or cancel it, there's actually a spot on the right-hand side of that email. So that's if you've actually gotten an invite for an appointment and booked an appointment with Johnson County for a vaccine. Now, for just the survey interest form, let's say you're over 65 and you filled it out and you were lucky enough to get it from your local hospital system. That's okay. When you get that email from us letting you know that you're next up for our vaccine, you can just delete that email and go on your merry way with your vaccinated self because the number of individuals we have in this community, and now that we have a number of partners vaccinating the 65 and up population, and as we move through our additional populations, it just becomes too much for our team to be documenting and going back and following up for everybody who's found another way to get a vaccine. So we will reach out to you. We will invite you for an appointment. If you don't need it, just delete our email and we'll move on. So thank you very much for that.
Another question. So this, if you think about the 65 plus, that Elizabeth, that number you just gave us, that 26,000, do we have a breakdown percentage wise or any kind of a breakdown? How many doses did you give versus hospitals versus pharmacies out of that 26,000 or overall? Do you know the different percentages of the different people that are, or the different systems that are giving vaccines?
So it's a very complicated question with a lot of different numbers thrown out there. We do have that data. I don't have it readily available, but this is something that we would be interested in displaying on that dashboard. Now that we have access to this data, it was one of the big things we were waiting for. I will say that all the people that we vaccinate goes into our electronic health record, and we have an internal dashboard that we're able to use to monitor that. And so we do have that data so we can sort of distinguish what we've given versus our community partners. And so stay tuned on that, and we will be working on getting that out for you.
Okay, that's great. Someone is asking, is there a phone number that we can expect to be calling us so we know to answer the phone? They want to make sure they don't miss a call. Is that the 2819 number? If DHE is going to be calling somebody to offer them a vaccine or offer them an appointment?
Go ahead.
A number of our staff are calling from their different office lines. And so it could be a number of different phone numbers. So I don't want to give one and say, this is the phone call to answer. I will say that the majority of our phone numbers have extensions like it's 913, obviously, but 715 is one of our extensions. 477 is another extension. So if you see one of those 913, 477 or 913, 715. That's a pretty good indication that it's Johnson County government. But if we're calling you to schedule an appointment, we'll leave a message. And so definitely check your messages and give us a call back if you get one of those. And then certainly, check your spam folder. If you did sign up for email, sometimes they go in there. And we've been trying to work through that, but not a bad habit to get into is just checking your junk folder every so often to make sure you haven't missed an opportunity from us.
Well, great. Well, as always, good information. Any closing remarks before we wrap up for today?
As always, just happy to provide updates to our residents and to answer questions that you may have and clarify things as much as we can. Again, if you have questions, email us jcdhe@jocogov.org or call us 913-715-2819. Very happy to assist you as much as we can. It's a fairly it's an operation with so many things going in so many directions. Just trying our best to make sure that we address those and simplify the process as much as we can. A reminder: you want the vaccine, and our ultimate goal is to provide the vaccine to you. So, thank you for your patience as we walk through the different groups and the different logistical challenges that are there. Thank you.
Great. Thanks to both of you for being here today. Thanks to Allison for helping us with ASL. Thanks to all those on Facebook who are watching and asking questions. And a reminder that tomorrow is Wednesday, so we will be doing this at 4:30. Wednesdays, we do this a little bit later because of a couple of other meetings. So we will be here at 4:30 tomorrow. Thanks so much and have a great rest of your day.